Tracy, I just sent you the link.
All right, waiting on it to come through. There it is. All right, let me go check to verify it is working. Advisory committees, occupational therapy.
Are we good to go, Tracy?
Yeah, it's there. They may have to click the link. For some reason with our settings, I'm having to, what are you doing? Okay, just want to make sure. For some reason with our settings, I have to copy the link and paste it in a new address.
Okay.
But when I do that, it works. Like when I click it, nothing happens. Can you verify it's happening for you?
Give me a second.
Let me go test it again.
I was gonna say I'm not able to click on it and for it to load.
Yeah, but if you copy it and paste it in a new window from there, I'm not sure if it's our settings. Go to Chrome, see what that does. I mean, Edge.
Okay, well, if it
For
won't
me,
click
it
on
said that
the
it
link,
was,
if it's not clicking straight through to the link, we got to make sure that we put those instructions, we refresh the instructions on the notice and on the website on how they can access.
I was able to do it on my phone, so it does work
Yeah, I think it depends on their settings on their computer.
yeah, for me, it just said that it was blocked, but when I did it on my phone, it went straight to it.
Yeah.
Okay, we're good then. I'm bringing everyone in now.
Yeah, in Edge it was able to go right through. It was a Chrome. It's got to be a Chrome setting.
What is it? Did it say it was blocked? Like our agency is blocking it, or
No, it's just not clicking. On mine, it's just when you
okay,
click the link, it doesn't click in
okay.
Chrome, but in
So
Edge it does.
maybe we should update the instructions that say some Chrome users may need to copy and paste into a new window or something.
Instructions where? I don't have
When
instructions.
okay, well, when we do the notice, we'll change it and then we'll
Okay.
but on the website, what do you put? You just put
It's
the
just a
link,
link.
right?
Yeah.
For me,
Okay,
it was only when I tried to open it in a new tab, it said that it was blocked.
maybe we should I'll get with you after, Tracy. I'm thinking maybe we should put a little parenthetical that says if the link does not work, copy and paste in a new browser window or something.
That sounds perfect. Yeah.
Okay, thanks.
Mhm.
Okay,
Yeah, if
ready?
you right click and hit open a new window, it works too. It's just clicking it for some reason. Let's see.
Good morning, ladies. Are we ready to start, ladies and gentlemen?
I believe we are. Do we have Dr. Van and everybody?
Yeah.
I'm here.
Okay.
Okay, good morning.
Good morning.
Meeting of the Louisiana State Board of Medical Examiners Occupational Therapy Advisory Committee pursuant to lawful notice is duly convened and called to order at 10:06 Friday, December 15th, 2023 via Zoom virtual video. Please note any comments by the public are welcome and can be emailed to publiccomment@lsbme.la.gov. Dr. Van, please confirm that you verified the identity of all the tele and video conference participants.
We have, ma'am.
Thank you. Is the sound clear and audible to the public and those on the tele and video conference?
It appears to be, ma'am.
Thank you. All additions to the executive or public agenda must be made presently, as we will no longer make additions to the agenda after the close of the public session. Just quickly to review, the mission of the OT Advisory Committee is ultimately to protect the public, that is the consumers of occupational therapy, by regulating competent practice and upholding the standards set forth by the governing rules and regulations. Okay, members present, myself, Darby Filbert, Chair. We have Ingrid Frank, Vice Chair, Brenda Martin, Raylena Crook, Amy LaRiviere, and Mary Green Keys. Ingrid, can you please confirm that we have a quorum?
Yes, we do have a quorum.
Okay, also present we have Dr. Vincent Collada, Patricia Wilton, Lauren Sutter, Olivia Pilong, Tracy Morrow,
Yes.
and is that everybody? Did I miss anyone? Okay, I assume that I didn't. Okay. Dr. Van, do we have any public guests?
No public comments at this time, ma'am.
Okay, thank you. Okay, the first item on the agenda is the approval of the minutes from the meeting on November 17th, 2023. We have access to those on the cloud share. Hopefully everyone's had time to review those. And if someone would like to make a motion to accept them as written.
I move to accept the minutes.
Okay, is that Brenda?
Yes.
I'll second them, Darby. All in favor, please say aye.
Aye.
Anyone opposed? Anyone abstain? And are there any public comments regarding the minutes?
And there are no public comments at this time, ma'am.
Great, thank you. All right, so we're going to move on to the rules and regs, at which time it'd be best to turn to the definitions page. It's also on the cloud share and was sent to everyone.
Can you share your screen so we're all sort of looking at the same thing, Darby?
You want me to share mine, or is it better to share yours so that you can edit as we
If
go?
it's the cloud share, I can't edit it anyway.
Okay, well, do you have a copy of it?
If you could pull, well, let me, I didn't actually look at the cloud share one. So,
It's
but
the same one that I sent out. If I can resend it to you if needed, just so you can make the revisions.
Yeah. Let me get to it.
So as she's pulling it up, I just will review with everyone. Anything that's in red was previously proposed by Ingrid and I as of May 2022. It's in blue. It was a new addition that was at the request of the OTAC committee of previous meetings. Anything in black is the current rules without revisions. Anything in green we can skip because it's been previously voted on. And if it's inside a table, it was an OTAC requested definition based on recent meetings.
Give me just a second while I find the right thing. Now the minute definition, no.
It should say definitions for rules and regs 11/26/23.
Now I have too many things open. Hold on. That's a problem. Rid of that. Now I should be able to find it when I share the screen better. OT roles, definitions.
1126 is the latest.
Okay, hopefully this is, mine
Yeah,
says, does this look right?
It says that you started sharing the screen. I
Hmm.
can't see the
I
definition
can read
yet.
it. It looks great.
You're not seeing it, Darby?
I'm not, but it's okay. Anybody else?
I can read it.
Brenda says yes.
That's so weird, Darby, why you can't see it?
Mine literally just says Ingrid has started screen sharing, but it doesn't show what you're sharing.
Okay, so it's a little behind.
Oh, there it goes. There it goes.
Does this look like the version that we are to operate off of?
Actually, it does not.
I don't know how I don't.
You want me to email it to you real quick?
Yeah, email it to me real quick.
Okay. Sorry, guys. Okay, it's sent.
Now we're gonna have to wait for it to come through on my side.
Yeah. Well, now it's saying that the system has encountered a problem.
Let me see if I can send it to you, Ingrid. Hold on 1 minute.
Ingrid, it was in the email that we just sent to Olivia.
That we sent to Olivia.
I sent to Olivia and I CC'd you for the updated and I asked if that was the most current rules.
Right.
This usually means that my internet's about to go out. So if that happens, just you'll know what happened to me.
Okay, I've got that email. Dr. Van, I'm good.
Got it. Okay, good enough.
Yeah,
Thank you.
Okay.
I'm good. So let me
No
open
problem.
it. I'm gonna stop that share and start a new share. Yeah, looks like it must be this one.
It should have like red on activities of daily living right at the beginning.
Yeah. Can Brenda, can you see it? Do I have the right screen up? No.
I see something.
It didn't change.
on top. Like I saw it for a second, but now
Oh, then let me move it back over here.
there we are. And Darby said it's the one with red on activities of daily living. So that's
Yeah.
Yeah, this is the one. It says 11/26/2023. Okay, I think we've got the right one.
Okay, great. All right, so I guess we'll maybe yeah. So the very first one we had proposed to take out activities of daily living. You know why some of these wouldn't be green. We suggested to take out activity limitation and the definition of AOTA. The next one up would be the AOTA guidelines. And that's in section 4911 and referred to in section 4929.
So do you want me to turn it green? We're keeping that.
I'm sorry.
Should I turn that green because we are keeping that?
Yeah, I guess the first two, as long as someone doesn't have objections.
Yeah, I think we should,
Yeah.
I mean, I would think we would need to have the AOTA guidelines and.
Yeah, so the AOTA guidelines, and we won't keep the section, that's just for us to reference in case we need to go back and see how it's used. But basically, the definition would be that, and again, these are up for edits, this is just suggested, refers to AOTA official document and professional policies that under scheduled review and updating. These documents are used by the AOTA and its membership to guide education, practice, advocacy, and policy on behalf of the profession. So one of the things that I thought was important in here is that they are updated regularly so that people can't just say, oh, I've seen that when I was in school and it was 20 years ago.
Darby,
Yes,
just as
sir.
a housekeeping measure, when you say guidelines 4911, 4929, when they updated, would they have the potential to renumber that?
So that refers to this section in their proposed new rules and regs
But
for
again,
us.
A, if it doesn't pass, then it doesn't exist. And B, if it does pass, it can be modified in a year or two, right?
Correct, but we wouldn't include that. It's just for us to.
Oh, okay. So you're not going to include the
for
reference.
today.
Okay. I'm
Correct, it's
sorry.
for
I did not
today.
understand that. That's what I was clarifying. Thank you so much.
Yeah. It's just where I'm like, sometimes I'm like, how is that used? What context? And that's just to make it easy for us to flip through the rules.
Sorry to be so slow on the uptake. I apologize.
No. Please ask. We need that. You never know where my brain has been or is going. Okay. Any questions or comments on that definition?
Darby, do we need to spell out what AOTA is the first time?
Yeah,
So
that's
the first time in the document that we agreed that we would do that.
Okay.
Like as though it's like a publication, like the very first time you put the acronym, you put what it stands for, and then it's for the rest of the document. That's what we've discussed at previous meetings.
So if this turns out to be the first time it's in the document, we'll spell it out. If this turns out not to be the first time it's used in the document, we won't. I guess we'll be like that.
Correct.
Makes sense.
Good. Okay. Yeah. Okay, so the next one, the applicant application approved course, those have all been approved already. Then the next one, Ingrid, tell me if I'm going slow because your screen still shows the other one on mine. I don't know why.
No, well, yeah, you can keep going. We're up to association.
Okay. Yeah, it's still showing your screen from the very first one that you did I don't know. Anyway. Okay, so assistive adaptive equipment, we've proposed to take that out. And then association, I would propose to remove that because we do not refer to LOTA as association. We refer to it as LOTA.
Sounds good. Next up is board. Oh, did we lose her? Oh, we did. Darby went out. I'm sure she's trying to get back. I think I'll keep going and let her rejoin us because we're not voting yet. Okay, looks like we had already talked about board. Looks like we changed the she might have changed the definition of client based on the AOTA 2020. Does this definition look good to y'all? Client may be persons, groups, or populations for whom the OTP is providing service. Anybody have any issues with that?
What's the difference between a group and a population?
Population kind of refers to, I guess, like I think of as disability populations versus groups might be
like groups that you're doing like group therapy with, and the population would be like the general public.
even that they're doing it, an OT is doing wellness.
It's okay with me. I don't care. I just, if those have a readily known distinction to you all as practitioners, that's perfectly fine. If I just didn't know the difference and I wanted to make sure it was an actual difference that is standardly used in your profession.
Yeah, it
Okay.
is.
Okay, cool.
Did we get Darby back? We
Yeah,
did.
yeah.
We got Darby back. I went ahead and moved on, and it sounds like everybody is okay with client. So I was about to turn it green.
Hands down, the
Okay.
best decision I ever.
So, yeah, there's like 3 different ones, but as long as y'all agreed on one.
Oh no, we didn't. I didn't realize we had 2 different ones. Oops.
So there's one in the
Oh,
box.
now I see we have 2 more to cover. Which
Yeah,
one came from the AOTA? Darby, the first one?
So if you add in the red, like the persons, groups, or populations, that's the AOTA one, the bottom one in the box, and the one that's like embedded into. So that's the one that you and I looked up for AOTA back in May. And then what is in black is what was previously there.
And what about the blue ones?
The first blue one, it was in some document. It looks like we didn't put the reference, but it may have been from a different rules and regs.
I can say this, the first one, the one that's quoted from the AOTA is the one we teach to the students, and it's the one that's in the OT practice framework. So I think we ought to stick with that one.
Yeah, it's the second one in the box. So it's also the one that's like written. Yeah. So that's fine.
So, and then just, I'm sorry, I'm the grammar person again. If it says client, is it then maybe a person, group, or population?
Yes, it is.
Ever made for the hub.
And so we're keeping for whom the occupational therapy practitioner is providing service, right?
Mm-hmm.
Okay, that brings us to client care conference, which has some blue in it.
Yes. So
that means that's something you added.
Correct. So what was previously there is a meeting between a supervising occupational therapist who must have previously evaluated and or treated the client, and an occupational therapy assistant to discuss client progress or lack thereof, client issues, revisions of goals, initiation, modification, or termination of an individual program plan, assessment of utilization of additional resources, discharge, and any other information that may affect the client's plan of care. The minimum standard of frequency for this meeting is monthly for each individual client. This meeting can be conducted using a variety of types and methods as outlined in section 4926 of this document. So at some point we said in the definition we needed to include the frequency of the meeting for clarification.
I like that.
I like it too.
Like the way it's written? Do you think it could be synthesized more?
I like that it's kind of detailed.
Yeah, I'm fine with it. I just, and so you see what we took out, except when specifically required in this chapter to be conducted by face-to-face conference, such meeting may be undertaken by telephone or other means. So we're not saying how the meeting has to happen. I don't know if that's going to cause some confusion. We want it to be face-to-face.
Wait, we're saying we're referencing where you can see how it can be conducted.
I think it's fine the way it is because we're saying those methods are outlined.
Right. And then it's choices. Yeah.
Right.
Okay. All right. So we're good on that one.
Related tasks.
Okay. So this is used in 4928. It's a routine task during which volunteers or unlicensed personnel, that is aide or tech, may interact with the client under direct supervision of the occupational therapy practitioner.
Looks good to me.
I think it's pretty much taken, like, that's how we have it written in the rules as well. So, next would be close client care supervision. And I just highlighted face-to-face to make sure we wanted to keep that. This is the original plus a little addition. Face-to-face observation of an occupational therapy assistant administering occupational therapy to a client, accompanied or followed in a timely fashion by verbal discussion of client goals, the individual program plan, and other matters which may affect the client's care plan of care. I did note that we do not use this term in the rules, close client care supervision.
Yeah, I think we should remove it.
Yeah, if it's not used, like,
Did we lose? Oh no, Darby, you're still there. Okay.
yeah, I'm here.
We lost you again.
I'm letting you catch up. Okay. All right, so the next one is close supervision. So this is in the temporary license section, just for reference. It says see direct supervision. That was in the previous rules. Mentions on premises direction and immediate supervision, not less than 2 hours each week, but we didn't specify if it was per client.
I guess that circles back around to the fact that we were going to look at the temp license section again today. But if close supervision and direct supervision mean the same thing, I think we ought to pick a term and use only that one throughout the document.
Yeah, I'm gonna look at where it says that.
Have direct, yeah, we've got direct.
So it says an OTP holding a temporary license issued under the section may practice OT under the direction of an OT licensed by the board, who shall provide such on-premise close supervision of an instruction to the temporary license holder as is adequate to ensure the safety and welfare of patients.
I would advocate for changing that language to direct supervision and removing close supervision from the definitions.
Okay. So we need to, I'll make a note that in section 1939. Everybody okay with that?
Okay. So we already had cognitive skills and coordination X'd out. We have compact privilege in green, so we already agreed to that. So basically that brings us back down to direct supervision.
Well, context and coping skills, we had X'd out too. So just to make sure everybody's okay with that. And then this is, okay, so this is color coded for the references. So in light blue, according to the level 2 fieldwork position paper, it's line of sight. Visual range is what was in the original rules. The brown is from Arizona. The supervising OTP is in the immediate area of the treatment or supportive services being provided. Direct in-site supervision of personnel providing client-related tasks and shall be readily available at all times to provide instructions. Is from California. And then in the DC statute, it says supervision in which the supervisor is personally present and immediately available within the treatment area to give aid, direction, and instruction when occupational therapy procedures or activities are performed. Pick your poison.
I like the last one, as long as it jives with where we use it in.
Yeah, I'm gonna try to pull that out.
I just think it paints a clearer picture of what we're going after.
Yeah, for sure. Well, especially if we change Ingrid said, if we change it to from close to direct, it's under the section of supervision of unlicensed personnel and volunteers. So that would, if we change that language, that would mean that the temp license is like getting the same amount of supervision as a unlicensed personnel and volunteer. So is that what we?
I'm back to being confused again.
Okay, it's under two, the use of the term direct supervision is under two areas, temp licensing section and unlicensed super personnel section.
No,
But
no, stop for 1 second. It's not. And under the temporary license, we had close supervision.
yeah, but it kind of meant the same thing. So what, under the temp license section, it says that this direct close has to be provided at a base minimum of 2 hours a week. And then under the unlicensed personnel section, it says that the direct supervision has to be all the time. So that's the difference. But so it's not quite the same thing as saying that an unlicensed person has to be directly supervised in the same way as a temp license, because it's a major time differential, at least the way we currently have it written.
So I'll read you what it says in the actual rules that we voted on. It's under section 4928F. Direct supervision is in quotes. It says is required for all unlicensed personnel and volunteers when completing client-related tasks at all times. The occupational therapy practitioner must be in the visual range of the client and the unlicensed personnel or volunteer and available for immediate physical intervention. Video conferencing is not allowed for direct supervision. So that's kind of a different definition.
I mean, sort of. What we have in red here under direct supervision would work as a general definition for direct supervision. Under the unlicensed personnel section, we add some additional caveats to supervising unlicensed personnel. But it doesn't dispute what we have in red right here.
Correct.
It doesn't conflict.
Right.
And then this red definition here would work well for the temp license.
Yep. Yeah.
I'm good with the red.
Me too. I say let's make the red green.
Okay.
Yeah.
Okay.
Moving on. I like it. All right. Next up, documents.
That got removed.
All right. And then we have dry needling. So the definition that we use in the rules and regs from section 4930 is in black. The skilled intervention that uses a thin filiform needle to penetrate the skin and stimulate underlying neuromuscular and connective tissues for the management of neuromusculoskeletal conditions, pain, and movement impairments. As with all other physical agent modalities in OT, dry needling is to be utilized in a therapeutic process to ultimately achieve improved function and therefore must not be applied to standalone treatment. Other ones were an instrument assisted modality in which thin filiform needles inserted into trigger points of targeted muscles and connective tissues with the aim of remediating muscle function and improving activity and participation. So if you want to keep what we have, if we want to revise.
I like the first sentence of the black definition. But I don't feel like we need the second sentence of the black definition, but that belongs where it is over there in 4930 because it further explains it, but it doesn't need to be in a definition.
I
I
agree.
agree. Just realize. I'm gonna look. Did anybody happen to take that survey that AOTA sent out about dry needling? That just came out. I'm gonna see if I can pull it up because it was. I don't think I was able to save it. Anyway, okay, never mind.
I'm just gonna put this sentence into green so everyone knows what we're talking about and see if that works for everyone, that part.
Okay.
You still seeing the old one, Darby, or
No,
is
I
your?
got it. It's back up. When my
Okay.
internet went out, it's almost like we can kind of tell when it's about to go out, like I said. But I attached it to a hotspot, so it shouldn't happen again. So yeah, so just take out the black part and does
that look good to everybody? That one? The stuff in green?
that's what we
Yes.
agreed on and is written in the rules.
All right, great. All right, moving on.
Okay. Okay, so we have a few definitions that we've X'd out. Then education. So this gets a little tricky. So we had an intervention process that involves the imparting of knowledge and information about occupation and activity. This does not include school-based occupational therapy. So that's the current definition in the rules before they were revised. Then we have added activities needed for learning and participating in the educational environment. I think we kind of started alluding to that at the last meeting. Where it's used in the rules and regs in 4909 school system, it's also mentioned in continuing education, professional education, fieldwork education, and in the definition of occupational performance in OT. So I think
Education is just one of those words with so many definitions
Yeah.
depending on where it's used.
Yeah, the context is.
Mhm.
Does it work if we keep this definition, but Xing out the part about this does not include school-based OT? Just remove that sentence. And then does it encompass what we needed it to encompass?
Yeah, I mean, I like that it says the intervention process because it's actually becomes part of the intervention.
Mhm.
I do like that part. So I think, yeah, what you're saying, Ingrid, is if we just take it out, do we need to keep the red for when we refer to it in school-based stuff? Or like fieldwork education, or is it kind of redundant?
The only reason I like it is because we've had so many school-based therapists who, we've said that they can see the clients in the school-based setting without a physician's referral. And so this helps clarify that. I think.
We hope.
Yeah, but I mean, the law still states that we need the referral, so I don't know how much clarification we're really doing.
Okay, I see what you're saying. You have to change the law too, I guess.
Well, interesting enough, PT and speech are opening their practice act the next session.
Well, we don't want to open our practice act now then.
Okay, so the black and the red, or?
I think the black works. Like I've been trying to read the black one and think about each kind of education, like where we use it. And I think it works for
everything.
Okay.
everything.
I'm good with that too.
Yeah, I'm okay with that. Okay. Environmental adaptations is not used in the document, so we can probably. And the next is evaluation. We have what's currently there, the process of collecting, interpreting data through direct observation, interview, record review, or testing of a client. And then we have two different definitions here. The first one is the comprehensive process of obtaining and interpreting the data necessary to understand the person, system, or situation. Evaluation requires the synthesis of all data obtained, analytical interpretation of the data, reflective clinical reasoning, and consideration of occupational performance and contextual factors. So that's quoted in the AOTA document. Texas says the process of planning, obtaining, documenting, and interpreting data necessary for intervention. This process is focused on finding out what the client wants and needs to do and on identifying those factors that act as supports or barriers to performance. And the only question I had there is if we want to add that this process has to be done by an OT.
Oh.
So I kind of like the second one, honestly.
I like the second one. The first one, I feel like I need definitions to understand the definition.
Yeah, and I don't like that it's like a direct quote with, you know,
right.
Yeah. The original one I feel like is just a little vague.
I do like the word like comprehensive or I think it just paints a better picture of that it's not like I just go give one test and I'm done. Like it's a big package thing that I'm doing for the client.
Well, some definitions include the word ongoing. Like that's kind of how we learned it. Like it's an ongoing process. So we could always throw that word in there.
Yeah. When we use it in the rules, do we refer to just the initial eval, or do we refer to the fact that it is like more general and ongoing?
I'll look it up. What 4909? I'll look. It's under the referral. Who they referred by. It says the occupational therapist assumes full responsibility for the occupational therapy evaluation and consulting with the referring healthcare professional needed.
And so I'm liking ongoing.
Yeah, and then we have an evaluation section, 4911, that talks about like you evaluate the client's performance according to current AOTA guidelines. Initial OT eval shall consider the repertoire of occupations. Kind of gets into more detail, but it's like all eval methods should be appropriate to age, education, cultural, and ethnic background. So it doesn't, like this definition that we have, we can just add the word ongoing and comprehensive, and then it would do it. And then it's just whether or not we want to include something that it's like done primarily by the OT.
I think that's implied with this document though, Darby.
Okay, that's fine.
And we delineate which parts the code can do in another section. I don't think we need to include it.
Yeah.
Can we what about getting rid of, it says this process is focused on finding out. Do we need finding out, or can we just say the process is focused on clients' wants and needs and identifying those factors?
Or this process is focused on what the client wants and
On
needs.
clients' wants,
Yeah.
needs, and identifying those factors. I don't know, it
Yes.
just seems too wordy. We don't need finding out.
Finding out. Yeah,
Okay.
that's a good
Yeah.
call.
Yeah.
Look at Amy taking Brenda's role. I like it.
Go, Amy.
Gonna have a new hat to wear, my girl.
Okay, so I'm going to X out the original definition and the top definition. And then,
Okay.
Take out what the too. Focused on clients' wants.
oh, the
Oh, the
process,
client's wants and
is
needs.
focused on the client's wants and needs and on identifying.
Yeah.
Okay. It's focused on, oops, why didn't that? There, on the client's wants and needs. And on identifying those factors that act as supports or barriers to performance. Okay.
Perfect. Awesome. We're good with that? All right, face-to-face. Direct communication between the OT supervising client care and occupational therapy assistant, which is conducted either in the physical presence of one another or on a HIPAA compliant virtual platform. So this is mentioned in the definition of client care conference and close client care supervision, but not in the document. So face-to-face, those words I think are only in definition, but not in the document.
So then do we need a definition?
Well, if it's in another definition, like, and you read the definition of like, let's see, the definition of like client care conference.
I think we
If the
took
only-
that.
If the only place it's used is in that definition, what if we just spell it out better in that definition?
I thought we took out face-to-face from that. We did.
We
This
did on
meeting-
that one. What's the other one it
Oh,
said?
Yeah.
We took it out.
What's the second one that it says that it's in? Close
Oh,
client.
fine. We took that out too, because we changed it to direct.
Okay, all right, so then we don't need it?
Right.
Yay, that term has given us so much hardship over the years. Okay, facilitation technique, we do not need anymore. General supervision in section 4926 is the minimal standard consisting of a client care conference at least monthly for each individual client.
Minimal standard of supervision.
Yes, probably. I'm looking it up. I was wondering the same thing. 49. That's under types of supervision. Required for all OT assistants by an OT, consists of client care conference at least monthly, minimal standard of client care conference frequency. That's how it's written in the rules. This is considered to be a minimum standard of client care conference frequency. Yeah, so we're good, right? Right. All right, good moral character. As applied to an applicant means that the applicant has not prior to or during the pendency of an application to the board been guilty of any act, omission, condition, or circumstance which would provide legal cause under 373011 for the suspension or revocation of OT licensure. The applicant has not prior to or in connection with their application made any representation to the board knowingly or unknowingly, which is in fact false or misleading as to the material fact or omits to state any fact or matter that is material to the application, and the applicant has not made any representation or failed to make any representation or engage in any act of omission which is false, deceptive, fraudulent, misleading in achieving or attaining any of the qualifications required by the chapter. So I put here that I thought we voted on this last meeting because I remember Patricia talking about it, and I said, like, I feel like this is like coming straight from the board, but I wasn't sure.
It does feel like deja vu.
Yeah, I think we I thought we did, but maybe I was wrong. Because
maybe I just didn't turn it to green, but I agree that that it was decided that it should be left in because it gives the board flexibility.
Yeah.
Okay. So I'll turn it green.
Yes, please. All right, group interaction skills, taken out. Health management, we added this, Ingrid, but it's not in our document.
Okay.
And then IADLs is also only found in the definition of occupational performance. So I don't know if we need to go down to that so y'all can see it, or if we need it.
I'm now on the definition of occupational.
Yeah, the act of engaging in any occupation, including the activities of daily living, ADL, instrumental ADL, rest and sleep, and education, work, play, leisure, and social. Is it assumed in our profession what an IADL is? I mean, that's kind of the other question.
Yeah, because it's not like we then defined all the other words in this list.
No, and we took out ADLs.
Right.
Yeah.
Okay, so take it
I
out.
don't see why we would need it. Yeah.
Okay. Then we take out inhibition techniques, joint protection and preservation, kinetic activities, leisure, non-obligatory, intrinsically motivated activity during discretionary time.
Is that actually in our document?
The word leisure is, I'm pretty sure. I can look it up. Y'all want me to? I have to close out a few things. Yeah. I don't know. Do y'all want me to see if it's used in there?
I really doubt it. Cannot imagine it's in there, other than in this definition for occupational performance. That's what it is. It's one of the lists.
Yeah.
Okay. If y'all want to kind of keep going, I'll be looking it up.
Yeah. All right, I'll leave it alone for right now. Limited permit, not mentioned in the document, see temp license. Well, I think we need you on that one too.
Okay, just give me 1 second.
Yeah.
Look it up. I'm pulling it up. Fine. Leisure. It's only used in the occupational performance.
Yeah.
We have another definition of play and leisure skills that we're probably going to take out. So we can probably get rid of it.
I think we are. All right. Okay.
Sorry, I didn't look that up before. Should have. Okay, so limited permit is not mentioned in the document.
Then I think we ought to get rid of it.
Yeah.
I'm not aware of us issuing limited permits.
Right. So I think that's
a goner.
right. Yeah. Don't give it life. License, we already voted on. Louisiana Therapy Practice Act. I guess we keep that as a formality. Patricia, is that? I mean, we do.
Yeah, that's fine. That's fine.
Okay. Mobility take out, motor skills take out, MBCOT take out, non-related client task. This is a task not directly involving a client, that is clerical activities and preparation of the work area or equipment. So that's going to be in your the section that's going to refer to the
Volunteers and aides and unlicensed personnel.
unlicensed personnel and volunteers. So that's from the supervision guidelines. Y'all okay with that? Does it need to be included?
I think we ought to include it as.
Yeah, I do too. Okay.
Yeah.
Okay, so maybe green on that one. And the non-skilled task is also in that section. Tasks that do not require judgment, interpretation, or adaptation. The following are elements of a non-skilled task. The outcome is predictable. The client's condition and environment are stable and will not require judgment or interpretation. The client has demonstrated previous performance ability with the task. The task process has been clearly established. So it just says unlicensed personnel or volunteers may only be delegated to perform non-skilled tasks. And we put it in italics because at the time we felt like it needed a definition.
I think it looks good.
Okay. All right. Object manipulation, take out occupational performance, the act of engaging in an occupation, including activities of daily living, IADL, rest and sleep, education, work, play, leisure, and social participation.
It's fine.
So in that sense, does our definition meet that definition of education?
Does our definition need the definition?
Like if you read this and you say, what is
Oh,
education?
yeah, I think
I think
this,
so.
this is implying that education is being used as this. I see what you're saying. In this context, the word education is not an intervention. It's an
Right.
area of occupation.
Correct.
Uh-huh.
If you want to be picky. I mean, but if you like it that and then you go up to the definition of education, it doesn't really apply to, you know, like you're saying, it's not the process of intervention, it's more.
Mhm. Yeah, I don't know if we tack on to this, the term education also refers to one of the areas of occupation in occupational therapy scope of practice. Or if we leave that alone.
Or is there another more updated definition that we should be using for occupational performance?
Oh. Okay, well. I can try to look that up in one of our guides.
And I mean, I don't want to rewrite the OT language, but it seems like in this context, we're speaking of like, if I'm a client, like my act of learning versus being educated, like receiving education.
education is a domain, no, the domain of OT consists of the following occupations which clients engage in through their lifespan. ADLs, IADLs, health management, rest and sleep, education, work, play, leisure, and social participation. So it's one of the occupations, the areas of occupation that clients participate in. And that's where health management came in, and that might be why we had added it. So this definition of occupational performance in the new definition that I just read to you, it includes the word health management as an area of occupation. So we probably should add that.
Yeah, we probably should. And then maybe under
Yeah.
education, we can just put like also included as an area of occupation.
That's what I was thinking, like to have education be the definition we have. And then education is also an area of occupation.
Correct. That's what I'm saying, Nick. You just add that to the definition so that it could be or.
Okay. Just gonna make sure there were no other ones that got added to occupational performance since we wrote this. What did I just say?
Health management.
Yeah, that was ADL, IADL. Then the next thing on the list is health management. Oh Lord, it's doing that weird thing. I'll worry about that later.
It's okay. Yeah.
Management, rest and sleep, education, work, play, leisure, and social participation. Okay, all the rest is the same.
Okay. So yeah, I think in health and management. I'm glad we looked at that then.
And then up here,
In education, we're going to add also included as an area of occupation.
can I say education also refers to or no?
Or do semicolon, right?
Huh?
I don't know if.
Well, how did you phrase it? Go ahead and tell me
I
again.
just put also included as an area of occupation. Not sure if that's a complete sentence-ish, but.
Yeah, it just doesn't feel like a complete sentence.
It's a parenthetical if you want to make it, if you want to put it in parentheses, otherwise. Yeah, then you'd want to make a complete sentence out of it.
Education is an intervention process that involves the imparting of knowledge. Education also it refers to one of the areas.
Yeah, I like the second sentence. Education also denotes an area of occupation.
Okay. Right there. Yeah.
Worry about that later.
All
Okay.
right. Make it green, please. Thank you.
And so I'm sorry, back up in the definition, does it say, and does it need to say an area of occupational performance? Or is that redundant?
Wait, under education, isn't that what we just said?
Well, yeah, well, we said occupation. Was that clear enough, or did we need to say occupational performance, since that's the.
That's
like,
where we're getting it from. Also denotes an area of occupational performance.
Yeah. Good catch. And we didn't define ADL, we didn't define IADL, we didn't define health management, we didn't define rest and sleep, but we did do education, which because it has other contexts, right? We didn't do work, play, but we did do leisure.
No, we took it out. We just took it out.
Okay. And then social participation. Okay. All right. All right, occupational therapist. Whoops, Ingrid, you jumped on us.
Yeah, I know, because I decided I needed to save this. It feels like we've been going and I hadn't saved it. So I need to do that real quick.
12:15.
Yeah, I'm trying, it won't only take me a second.
No, that's fine. Better safe than sorry.
Yeah. I gotta get it to the right folder or else that's gonna be another headache.
Oh, yeah. I feel that pain a lot. My OTAC folder is humongous. I'm just gonna pass it all on to Ingrid.
Okay, we're ready. We're up
Okay.
to occupational therapist.
All right, a person who is licensed to practice occupational therapy as defined in this chapter and whose license is in good standing. And then right under that is occupational therapist, a person who is licensed to practice occupational therapy is defined in this chapter whose license is in good standing. I don't know why that's listed twice. That's fine. Yeah. Yeah, okay with keeping that?
Yeah.
Okay. We'll turn that green, and then the next one, make sure you put that green, please. Thank you. And then the next one is occupational therapy. So we have the black one, then we have a green one, and then the bottom green one is the last revision. And the reason that we revised it again was to include physical agent modalities. So just so you know, we've already done this. Like, I don't feel like we need to read it and go through it again, but
Looks good. Okay.
and then we have assistant, which we revised, and then we revised again, saying that they are not able to do, they're able to do some physical agent modalities with the exception of dry needling.
Okay.
Right, then the next one we have is OT Code of Ethics. So this is referred to in two places. It's a document designed to reflect the dynamic nature of the profession, the evolving healthcare environment, and emerging technologies that can present potential ethical concerns in a research, education, and practice. Yeah, okay with that. That's taken right from AOTA. So,
Make it green.
Yeah.
yeah.
I just think it should also be called it should similar to the next definition, OTPF,
An official document.
official document of the AOTA design 2.
Okay, I'm okay with that. Whoa, what was that? Okay. OT practice framework, domain and process, an official document of the AOTA that presents a summary of interrelated constructs that describe occupational therapy practice.
Yep.
That's
Okay.
good.
So we probably don't need to include American Occupational Therapy Association, and we can just use the acronym.
Correct.
That'll be a formatting thing.
Yep.
OT practitioner. When the term OT practitioner is used in this document, we can probably take that out. It just refers to both occupational therapist and occupational therapy assistant.
Okay. You want me to take out in this document or just?
Yeah, I think you just
okay.
started with refers to both occupational therapist and occupational therapy assistant.
Okay.
Started with refers.
Oh, okay. It just get rid of all that and just it refers to.
Yeah.
Okay, that
You could
makes
say that in every definition, but I don't know
Or,
if you put the word it.
right, I would just start with refers.
Refers. Yeah. You can take out the AOTA reference. That. Right. right? Everybody okay with that? So on premises direction and immediate supervision, let's see direct supervision.
I think we ought to take that out.
Okay, yeah. That just causes confusion in my head. OTAC, we said we were gonna put that, and we already voted, take out person, take out performance skill, and take out periodically. And then physical agent modality, those modalities that produce response in soft tissue through the use of mechanical devices, light, water, temperature, sound, or electricity. Physical agent modalities are characterized as conjunctive methods used in conjunction with or in immediate prep for patient involvement in purposeful activity. We already voted. Sorry, we didn't have to do that. Play. Do we need to keep that or can we take it out?
Take that one out.
Take out play leisure, positioning, practice experience, psychological interpersonal skills, reality orientation. And then we have reevaluate, reevaluation. So there is also a definition in blue under, but the previous one was the process of periodically and systematically reviewing and interpreting the effectiveness and efficiency of client goals, the treatment plan, intervention, and any other aspect of the individual's OT program. There's another definition by AOTA that it's the reappraisal of the client's performance and goals to determine the type and amount of change that has taken place.
I think we had kind of agreed that we didn't want to use periodically anymore because that puts a every 2 week or every 6th visit, whichever comes first. And
yeah,
we wanted it to be more flexible.
Yeah, that's why it's highlighted.
So I like the new AOTA version.
Yeah, I feel like it I mean, it doesn't specifically say like the goals, the treatment plan and the intervention, but well, it does say the goals. So it changes it to performance and goals. So
The only thing about the AOTA one is it doesn't imply that the therapist needs to, I don't know, reappraisal. I guess the term reappraisal does.
what do you mean?
Or one thing about the current definition is it says it's to interpret the effectiveness and efficacy. And the AOTA definition is a little bit more wishy-washy.
Well, I think we can combine them. Dr. Van, you have a question?
I was going to suggest that maybe as often as needed to maintain quality care and accurate information on the progress or lack of progress in meeting the plan goals for the patient.
That sounds official.
And we want.
Well, you know, if there's ever a question, we're going to come to people like you or even to the committee and say, does this interval, in your opinion, based on the records, address the fact that we gave quality care and they documented the lack of progress or the progress in a reasonable fashion toward the plan goals? I mean, y'all are the experts. We just want to be able to give us some language that allows us to use the expert opinion.
I'm just writing and then y'all can tell me to change it. I just wrote that. But
is it efficacy versus efficiency?
well, I took that from our old one, but that it had
effectiveness, right?
But
the efficacy.
My bad.
Do you still have a comment? Your hands up. Dr. Van, do you have another comment?
No, I'm sorry. I'll lower my hand. I apologize.
I like the word effectiveness. I was confused about the efficiency word. I like the word effectiveness.
Yeah, I guess the efficiency is trying to imply that the OT needs to look at, do I still need to see him 3 days a week? Well,
Right.
is one gonna do it? That.
Right, yeah. Is that, like, do we need a comma or does that need to be 2 sentences? So reappraisal of the client's performance and goals to determine the type and amount of change that has taken place.
Well, what about progress instead of change that's taken place? I don't know. Change
Yeah,
that taken place doesn't sound right to me. Something's, I don't know.
but you can replace it with progress.
I like
Not
progress there, yeah.
the amount of progress.
Or lack thereof.
Mhm.
Yes.
So right there,
Reappraisal, so you,
so
You're
to,
saying-
to determine the type and amount of progress or lack thereof, period.
yeah, that has taken
And-
place. The
No.
reevaluation should take place as often as needed.
Take
Yeah,
out
like-
that has-
This occurs
Have
as
to,
often as
and
needed.
in order with the plan goals for the patient. I mean, if they have a plan, they need to be documenting what's going on with that plan. I think that's the key.
And I think we were gonna put or lack thereof after amount of progress.
I like lack thereof in place of that has taken place.
Yeah.
And then just the reevaluation takes place as often as needed. Or occurs as often as needed.
So that kind of takes the place of the word periodically.
Yeah, but it still leaves it kind of more general and leaves it to where, like, if I'm in a highly critical situation where I'm reevaluating like every day versus, more of a long-term residential mental health setting where where things are more stable and I'm reevaluating less often.
Right.
I like it.
I like it.
Okay, reappraisal of the client's performance.
I like it. And it doesn't, like, if I read the word periodically, then I'm looking for, well, like, what is that
How often do I have
period?
to do it?
Right. Whereas this is just has more like just a flow.
Yeah. Okay. Because basically before it was saying that every 6th visit we had to do a reeval.
It's exactly.
That's how periodically was defined.
Mhm.
Okay, position statements. Because it's no longer called papers. Position statement presents, that's the wrong tense, an official AOT stance on the provision of services, practice of occupational therapy, or rule of occupational therapy. So we just refer to this. We need to fix that little.
Then
This is under the section of supervision of OT and OTA students. OT and OT assistant students completing their clinical education will be supervised as per current AOTA guidelines and position papers. But
So we
we
need to change that.
change it to position statement.
What page is that on, of the rules?
It's section 4929. What page? It's 23.
Okay.
But I highlighted it. It's highlighted, so it says needs to say statements, not papers. But I can't change it because we would have to vote on it.
Ah, okay.
So I'm very tempted to go and change things, and I'm like, I can't. So I
Okay.
just write little notes. Okay, we're good with that.
Yeah.
Is the word present there correct? Why does that seem funny? Position statements present,
It works now that she put the S on statements.
or is
like
it just like
position-
refers to the official AOTA documents, or like we just don't start a definition with the word.
Oh, I see what you're saying.
You see what I'm saying? Like
Um,
the definition of position statement starts with position statements. Like we haven't done that. Like
Okay, so just start it with present.
or
Or-
just
or
is it just like
provide,
official AOTA documents that
or just, yeah.
Oh, okay.
we still need a word in
I
there.
know that it's an official document. It's because official documents are reviewed every 5 years and position statements aren't necessarily, so I don't think we can call it an official AOTA document because they refer to it as a stance. But anyway, we can get rid of all this and it's just an official AOTA stance, right?
Can we start the definition just with the word, or just, yeah, an official, or if we needed a word, provide,
Position statements.
but I don't
And
think we need a word.
is it an official AOTA stance on the provision of services, practice, or role of OT?
Okay, I think that's
And
better.
that would be- Then this would be singular.
Yes.
Yeah.
Okay.
Okay. Practice standard, not document.
I'm sorry, I'm back to the
Go back,
position
go back.
statement. Does it need to say AOTA position statement? Is that what we're actually defining? We're not defining a position statement of some other institution. I might just be being picky. Or in the rule, what do we refer to it as AOTA position statement, or do we just refer to it
Let
as?
me find it. We say per current AOTA guidelines and position papers, but we have to replace it with statement. Because there's more than one statement, right? Like they have statements on different subjects.
Right.
Yeah,
Right.
So it is plural.
But not the way we defined it. I've got it defined as an official AOTA stance on the provision of services, so.
Which I think is fine because we're referring to all of them in the section. But in this one, it's like referring to each one that would be appropriate or applicable to what you're doing.
Right.
Gotcha. I'm good.
Okay. Practice standard out, referring healthcare professional. This is, I think, in the referral section. A licensed healthcare professional who may refer clients to occupational therapy for direct service intervention for their specific medical conditions. Qualified referring healthcare professionals consist of physicians, dentists, optometrists, physician's assistants, or advanced practice nurse practitioners.
Looks good.
Convenient.
All right, rest and sleep we can take out. Screening, the process of reviewing available data, observing a client, or administering screening instruments to identify a person/clients or a population's potential strengths and limitations and the need for further assessment. I'm going back and seeing, did we not have this defined before?
This has come up a lot in the past because of the school system.
Yep. Well,
Um,
just anything, like even like kids, like if you're at a daycare and they're like, can you screen them to see if you need therapy?
I mean, I like the way it's written. To me, it captures what a screen is supposed to be. You look at data, you observe the client, you might administer an instrument in order to identify whether they have the need for more in-depth assessment.
Just very hard to read, but maybe that's just.
I'm with you, Darby. Like, I like the concept. I was looking for a way to make it easier.
When you list like that, do you do like person, client, or populations and make it all possessive as the group?
Mm-hmm.
Isn't that what you do? Like a person, comma, client, comma.
I would remove the word client because implied in screening is they're not your client yet.
Well, that's true. And would we screen a population?
Process? I don't know how we would screen a population. That feels weird to me.
Identifying a person, potential strength.
And then in the first line too, observing a person.
A process of reviewing available data, observation,
Or just observing.
observing, yeah. Or administering screening instruments to identify a person's potential strengths and limitations and the need for further assessment.
I like that.
Mm-hmm.
Take it out, take the quotes off probably.
I like it.
We're at the halfway mark, so we're almost there. Are we all itching for a break? We have a lot.
I mean, do we still have a lot of definitions? I was hoping we could break after definitions, but we actually do still have a good number, huh?
Well, the only big one, scroll down a little bit, is that big blue one. We might be able to get through it. That's.
Social participation we're taking out.
Yeah.
Okay.
We might be able to do it. Standards for continuing competence in OT document serves as a foundation for analyzing the occupational therapy occupation in regard to continuing competence.
That does not make sense.
That is
Do we
taken
start it
from
with
the
this is
AOTA,
this
what
is an
that document-
AOTA document?
I'm looking up how we refer to it. It's in the standards of practice. It says an occupational therapy practitioner abides by the most current AOTA occupational therapy code of ethics and the most current AOTA standards for continuing competence by establishing, maintaining, and updating professional performance knowledge and skills. I didn't know how else to define it.
I mean, I like the definition, and then we just start it the same way we started the other AOTA ones. It's an official AOTA document.
But there's also something wrong with for analyzing the occupational therapy occupation. That can't be, we must be misquoting it. It's really about the therapist's continuing competence. Standards. Continuing competence. I've got the standards for continuing competence right here.
I was gonna say, I can click on that link.
Let's see. Okay, serves for analyzing. Yeah, the occupation in regard to continuing competence. I have to say, I don't like their definition. The AOTA standards for continuing competence serve as a foundation for analyzing the occupation in regard to continuing competence. I think that must be a typo for them.
Well, I'm like, I really just cut and pasted, I think.
Yeah. It should be for analyzing the occupational therapist in regard to, or occupational therapy practitioner.
Yeah.
I don't know. We can put it how we want it though. I mean,
An official AOTA document that serves as as a foundation for analyzing the occupational therapy practitioner in regard to continuing competence.
How about the continuing competence of the occupational therapist practitioner?
I like that.
Mhm.
Thank you.
There you go.
Okay, so this one we're starting with, is everyone okay with that one?
Yes.
Okay,
Right. Official AHA document. That's what it is.
so
Yeah.
we're starting this one,
Standard
official
of practice.
document that outlines the requirements.
So the only place we refer to this is in the definition of service competency and practice standards.
Oh,
So we don't refer to this in the document.
well, I don't think we would need to define it then, huh?
Probably not. I mean, the definition of service. Did we keep it in service competency and practice standards?
It's right here. The ability to provide OT services in a safe and effective manner. With respect to an OT assistant, this means one who is appropriately trained and qualified to perform OT in accordance with the current standards of practice for the relevant population and setting.
Not as a document, though.
No, but we do then, yeah, we use the word standards of practice.
I don't think people would connect that unless we make it more.
Yeah. Let's see what they have to say about this. So the standards of practice basically says this document defines minimum standards for the practice of occupational therapy. Is that what we have? No, we don't. That's what this says. This document defines minimum standards for the practice of occupational therapy. So if under the definition for service competency, we mean that we're referencing the AOTA standards of practice, we probably should say so.
Right. Or like make it uppercase, like it's an official.
Yes. And then I guess we should include this, but can I just change it to what they've got here? Defines the minimum standards for the practice of occupational therapy and an AOTA official document that defines. Okay.
I say yes.
Yeah, an official document.
So that's all that's got to say.
Okay.
I would
Okay.
just put official before AOTA to make it the same.
Yep.
Yeah.
Okay.
All right, supervising OT and occupational therapist responsible to the client for occupational therapy who observes, directs, consults with and retains responsibility for the service competence and performance of an occupational therapy assistant in the administration of occupational therapy to such client. I don't know that we need to such client.
Hmm.
And do we need just responsible to the client. Like, do we need the extra for occupational therapy?
I don't like that thing, but like an occupational therapist responsible to the client.
Who observes.
Observing. Yeah, I think keep taking out an occupational therapist who observes, directs,
Oh, I see.
or is that meaning like specifically to that, like I'm supervising that OTA for that client? Is that why they put that? I mean, I think it's fine without an OT who observes, directs, consults with, and retains responsibility for the service competence and performance of an OT assistant in the administration of OT.
I like that.
Yeah, so we
Yeah.
can take it responsible to the client.
I like it.
Okay, are we under supervision? I would rather take out the word aid. Oh, I don't know. Because they are not supposed to be providing occupational therapy services. They're providing directed activities. It implies that an aid is actually, this definition implies that an aid is actually providing occupational therapy.
Right.
I don't
That's
like.
what I highlighted. So we can take that out.
Are we
I
gonna
mean-
get in trouble with periodic?
Yeah.
Or
Do we just put ongoing review? I don't know, do you have to define that too, or just take out the word, just a collaborative process for responsible.
review and inspection. I like it better now.
I mean, I kind of like the end part within the scope, like supervision is like a process aimed at ensuring the safe and effective delivery of OT services and fostering professional competence and development. That's kind of really, I mean, I guess I'm just questioning like if we need all of that in there in the
Oh,
definition.
your question whether you need it. I see.
Yeah, I mean, I see, I don't know, what do y'all think? Like, I feel like it just goes on and on and on, but it's kind of important, but
I actually like that second sentence or third in the sense of giving the overview of the reason for it.
yeah, yeah.
It just kind of sums it all up. Like, this is why you do it.
Yeah. Okay, I'm fine with it.
It's awfully long, but
Is responsible the right word? What? Why am I having trouble with that? A collaborative process for responsible review?
I would just say for review and inspection of all aspects of OT services. Or even for just for process
For
I
the
like
review?
inspection. I like
Everyone
it.
good with that?
Mhm.
Yeah. All right, the next one is the big one, like this whole temporary license versus temporary permit versus provisional temporary permit, like. We have the AOTA Final Model Practice Act says an applicant who is currently licensed and is good standing to practice in another jurisdiction and meets the requirements for licensure by endorsement may obtain a temporary license. And then the one in Texas is not really that applicable to us. I guess this is kind of more of a, is this like a Dr. Van question of like the definite, like what are we calling it and what does it mean for when?
This whole thing might be have more with,
All right, if we're talking about the temporary license, we would prefer not to use that term. Would be better to use it as a temporary permit. But then my concern about this is how many times do you want them to fail the test before we stop issuing it?
and we do want, another goal of today's meeting, Dr. Van, is to actually look at that section of the rules, because we felt like we needed to go back and look at that again to re-review it. So maybe we ought to review our temp licensing section before tackling the definition.
I think so. I think we need to do that because we have a section called temporary license. And if
And
that's not the term we want to use, we need to
Yeah,
change
we'd
it.
like,
Sounds like we want to
it
change
would
it
be
to
better if
temporary
it's a
permit.
temporary permit. But the real issue is if you fail the test, if you know, it's okay. So let me ask a question, and I hate to be so ignorant, but help me out. How many times a year is the test given by the NBCOT?
Ooh. Probably 20, 25, like twice a month.
Why would we give anybody a temporary permit if they can take it twice a month?
Yeah, because this was written back when it was like once a year, twice a year.
I mean, it sounds to me like if you graduate today, you can probably take that test, before the end of January, at least once or twice.
The way we currently have our temporary licensing section written is that you can continue to work under your temporary license even if you fail the test.
Is that something you think is in the best interest of the public?
Well, that's why we wanted to go back. So let's go ahead and just table the definition. We will be getting to changing temp license hopefully today, but let's just move on from the definition. I think we just need to.
Yeah,
So we can
and then
try to
we
finish the
need to-
definition.
We'll come back, no problem.
We're gonna come back to it, yeah.
Okay.
So we're gonna keep that all.
Unlicensed personnel, don't skip unlicensed personnel, 4928. An employee who provides supportive services to the OTP, commonly referred to as an aide, a tech, or rehab tech. Unlicensed personnel do not provide skilled OT services, but perform specifically delegated client and non-client related tasks. So I don't know if it's technically an employee. Could it be a volunteer? No, maybe not.
No, we had decided that a volunteer was different. Unlicensed personnel refers to we did have that conversation. We decided that we wanted to keep personnel meant an employee.
Okay. Okay. So we've kind of already done that definition then. Right, unprofessional contact, we've already voted on. Volunteer is an individual who is volunteering their time to support occupational therapy services. Volunteers do not provide skilled OT services, but perform specifically delegated client and non-client related tasks.
I like having it separate. We were struggling keeping them in the same.
Yeah. All right, wellness, I don't know if we need to keep that or not.
Well, because under our current practice act, we don't have to have.
Oh,
if
yeah.
it's a referral
Yeah.
for wellness, I think we need to keep the definition.
Yeah. An active process through which individuals become aware of and make choices toward a more successful existence. Wellness is more than a lack of disease symptoms. It's a state of mental and physical balance and fitness.
I am wondering if the AOTA has a more updated
Yeah.
definition for that.
Darby, really quick, for volunteer, do we need to add the term non-compensated, or do you think that matters?
A
Like they're a non,
individual.
Like they're not being paid.
yeah, not on payroll type thing, or do you think that's implied with the employee definition?
I mean, I think the word itself, volunteer, like kind of implies it, but if you think it's important to clarify it, does it matter if they get paid or not? Or does that bump them to like a tech? Like, you know what I mean?
Yeah, I would think that would. I just didn't know if it was important clarification or if it is implied, like you said.
I feel like it's implied, but if you want clarification, I'm fine if we, it doesn't hurt to.
Or,
There we go.
or better to, instead of the word employee up in the other one, call them an individual who was compensated, monetarily compensated.
Yeah.
To provide supportive services.
Well, I think that's what an employee is, though.
Yeah.
Okay. I'm trying to see if wellness is, there's a new definition of wellness anywhere. And then, well, I guess we're gonna take workout, right?
Yeah.
Yeah.
We might have to come back to wellness. I don't know, I feel a little hesitant with our current definition. It feels, this doesn't feel like the way we talk anymore.
Yeah.
But we would have to probably do a little more digging to find that.
Yeah.
So, I don't know, can I turn that one blue so we have to come back to it, similar to the temp permit?
Yeah, sure.
Let's turn that one blue, and then this one work we said we were gonna get rid of.
Yeah.
All right.
And that's the end of definition. Except for 2, so not bad.
So, other than the 2 in blue, we can vote, huh, on the rest?
Yes. I will motion to approve the changes in the definitions.
I will second it, Amy.
All right. Very good. We got Darby and Amy. Got it.
Okay, so we will take a 10-minute break, which puts us back here at noon. And we do have an ethical thing that we think will take about 30 minutes. So we have a decision to make as if we want to do the definition and then break, or do the ethical thing first and try to stick to 30 minutes and then come back to this.
We better do the ethical thing first.
Yeah, I kind of feel the same way, but we'll just keep in mind that we're kind of on a time thing. Fair enough?
Do we need to see if there was any public comment or anything before we sign off on
Yes,
this
we do.
vote?
And I also need to say all in favor, please say aye of the vote.
Aye.
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 Okay. Anyone oppose or abstain? And any public comment?
Madam Chairman, you have no public comments at this time.
Okay, let's take a break till noon, 10 minutes. Is that fair?
Yeah.
Bathroom and
looks like everybody's.
Yep. I'm on the AOTA site trying to find this definition.
Oh. Boy, you used your break well.
Well, we did complain about the use of how hard it is to navigate the AOTA website. Anyway, I can't really find it. Okay, so Dr. Van, I think what we're decided is to go ahead and go into the executive session.
All right.
So we need a motion, correct? Move into executive session?
Yes, you would.
Okay,
I'll motion to go into executive session.
okay. I'll second it. All in favor?
Aye.
Aye.
Anyone opposed or abstain? Okay,
All right, I'm moving everyone now.
thank you.
You're welcome. You should see the join button now.
Yep.
Tracy, I'm gonna leave you outside of executive session.
No problem with that at all.
Everybody back? Are we okay to proceed?
Yes, ma'am.
Okay. I will make a motion to recommend for the ID number 296217 that the board waive the rule for this person due to her circumstances and recommend her for licensure as an OT.
This is Brenda. I'll second it.
Thank you. All in favor? Please say aye.
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 Anyone opposed or abstain? Okay. Any public comment? Well, I guess there can't be because it's a discussion.
There is no public comment, ma'am.
Okay, great. Thank you. All righty. Back to it. So the next part would be, the next order of business would be the temporary license section, which is 1937. And it's going to get to the question that Dr. Van was asking. Do we want to allow the provision of temporary licenses for people who do not ask the board? Like, I guess.
I'm gonna share the screen with the rules.
Okay. Yeah, I should pull mine up. So it's really the people who do not meet, or it's on page 5, who do not meet or possess all the qualifications and requirements for licensing. The board right now can issue a temporary license and entitles the holder to engage in the practice of OT in the state for a period of time specified by such license and creates no right or entitlement to license or renewal of the license after expiration. So it gets the question of, do we want people to be able to practice who have not passed the board?
I'll give the first opinion and we can hear others. I would like us to be able to continue to give a temporary permit for someone who has either not yet taken or has failed it once, which is how we currently have it written. Due to the level of student debt, the strong desire to get started working as soon as possible, and the fact that occasionally you have really strong students who are not strong test takers, I do support the ability for someone to practice prior to taking the board, and if they have failed it once, using a temporary permit. That's my opinion.
Dr. Mann?
You're muted.
I apologize. Please forgive me. I'm concerned the way you structure that is, how long do you want them to be able to wait to take the test?
We currently have something about how long the permit can last?
It says for a specified number, for a period of time specified by such license.
So this is the question. How, if you're telling me they can take it twice a month, is it fair to say that they should be able to do this will never be valid for more than 60 days or 30 days or 45 days?
I think we could come up with a date of the time limit, sure.
I mean, I think you should put a time limit, because if they don't take the test, then they're practicing and with no intention of even taking the test.
Here it was, the temporary, we did already have something on that. The temporary license shall be valid for 3 months or until the date on which results of the qualifying exam have been known. We probably could just simply say 3 months, because this, again, this was written at a time when it took a long time to get the results, and they come really quickly now. So we probably could change it to just 3 months.
All right, so let me ask this question. They they go a month, they take the test, we get a failing grade. They're out.
Well,
no
the way we
longer-
have it now, the way we have it now, I think they can still go having failed it once. Let's see.
But you proposing that they only fail it once. If they fail it once, they don't get the temporary, and we're gonna change it to permit. Understand it's gonna be a permit.
Right.
So what I want to make clear for us is to understand that whenever they take the test, if they take it in 20 days, 30 days, 40 days, 50 days, if they don't pass it, they don't have a temporary permit anymore.
Okay, here's the section we currently have. A temp license shall be renewable only once. That's what's our current language.
But is that what you want?
I'm just letting nobody know what we currently have so we can see if we want it or not. A temp license shall be renewable only once if the applicant has not passed the exam or if the applicant has failed to take it. Exceptions to the one extension rule can be given at discretion of the board. So what we currently have is that the permit will last 3 months and that it can be renewed one time based on failing the examination or failing to have taken the examination. We can change and tighten this up any way we want, obviously. I was just trying to get everyone to understand where we're at.
So they fail the test, they can get it, they can apply for it and get it. And then if they fail it again, why would they get it the first time? I'm getting confused with the fail the one time, because wouldn't they get it if they failed one time and then we're giving them another lenience?
It actually doesn't say about failing at one time. I misspoke. It says the temp license shall be renewable only once.
Once.
Like if under our current language, you can have a temp license for a total of 6 months, 3 months plus 3 months. And in that 6-month period, you could probably fail it 3 times because we don't have anything about the number of times of failing.
Until you hit 4.
Yeah, until you hit 4. Right, that's our current. Now, if we want to make that tighter where it's 3 months only and can't be renewed and I don't know, that's fine, but
So maybe like if you fail it once, you can get it for 3 months and then you cannot get it again until you pass. And if you hit 4, then you can't. You can't get a license.
That's an idea for sure.
Yeah. So, I mean, what are other people's thoughts on this? Anyone have experience with students? This is kind of where I wish Carolyn and Kim were here because they're dealing a lot with this.
I want to say in a previous meeting, they had spoke to that, like, even though the test is offered frequently, there, depending on when you graduate, there still may be a lag and when you can actually take it.
And also, especially because sometimes the testing site nearest to your house fill up and not everybody has got the means to travel to a different state or city and spend the night elsewhere to take it. So they have to wait within their own city until it comes back around again.
And so I guess I'm trying to wrap my head around like I mean, are we talking a 2-week lag time or are we talking a 6-month lag time?
Well, it would never be as long as 6 months. I can't really give a specific, but they'd never have to wait as long as 6 months for the exam. It's probably more like 1 or 2 at the most months. In there, if they want it faster, they can go to other places.
That's right. And yeah, so I mean, so that kind of puts me to thinking that, I come out of school and I kind of know going in that I don't work until I take the test. And I think that kind of aligns with, I don't know about other medical professions, but I know well, no, okay.
I do know that
I'm going to stop thinking out loud.
PTs definitely do allow new graduates to work under a temporary permit, and they even allow them to keep working if they have failed it once. Cause I worked with a PT not that many years ago who failed it, and he continued working at Ochsner and then he passed it the next time. I don't know anything more than that about it, but he was able to continue working.
I guess it just seems cleaner if we're saying you need to have passed the test to get the license. It just seems cleaner to say just that you need to have taken the test to get the license. And I mean, I get the reality that, you know, for folks that does create a lag between maybe when I accept my diploma and when I start my job. However, it seems like a cleaner way to say we've kind of vetted that I'm ready to start my job.
I will say this, it would help our first time pass rate. Frequently, people who have to take the test a second time are ones who are working. They're not at home studying. I haven't done an actual study of that. That's anecdotal.
Refresh me, Ingrid, like when you graduate, the time between you graduate and you take the test, are we given temp license or permits right now?
Yeah.
Yeah. And then when they pass the test, then they get it. So yeah, I mean, it's just whether or not we want them. Does anybody here, I don't know if maybe Mary, if you're still with us, like anyone hire like new grads or anyone like continue students who were there on field work, like with temp license, like how much experience we have in this situation of time, just so we know what would be the time.
You know, the VA is so different. The VA is so different because it just takes so long for somebody to be hired anyway. So by the time that person would be onboarded, they would have taken their boards, and so it's just a little different process here.
Gotcha.
Because of the time it takes, you know, to onboard.
So Dr. Van, in terms of
Raylina, wait, Raylina has her hands up. That's okay. Raylina. You're on mute. Raylina, do you have something?
I pushed a button and I didn't know how to get back. I'm having to do all this from my phone because the VA does not allow Zoom. So speaking of the VA, but a side note, I was living in California when I graduated and had to take boards, and I got a temporary permit straight out of school because I needed to get back to work, and my fieldwork facility wanted to hire me. The goal was to become a permanent employee after my licensure. But given certain circumstances that were going on, deaths in the family, situations with custody and things like that, I didn't pass my first time, and I had to terminate employment immediately upon failure of that first boards exam. And it was devastating, not just emotionally, but financially. My student loans had gone back into repayment by that point. I had no income. I had to stop, repay for a very expensive exam, and focus on studying. And I'm studying things that I hadn't had a course in almost 2 years. So it's for Louisiana to be able to provide that, the grace to be able to take it one more time, I think is great personally. But that's just my personal experience. I think that's where we have all the measures of supervision and all that good stuff in place. There's a reason for that, and those are the reasons. I do like the language change from temporary license to temporary permit. That gives a very great distinct difference. But I think the grace of being able to take it again is wonderful.
Thank you for sharing that. What do you think is a fair amount of time? Like, you know, if we like 30 days?
You mean for the total time of a temporary permit to last, it need to be closer to 3 months.
I think the time that's written now is good, personally.
Okay. Ingrid, you were going to say something earlier about Dr. Van or to him?
Oh, I was about to ask if physicians are currently not allowed to practice until they've passed their boards.
Dr. Van? His video is not on, so I don't know if he stepped out maybe.
So we have a similar rule for physicians, which is they have to pass their specific tests, the tests that are required within so many tries. And if not, they have to come to the board and get a waiver. But we don't actually have temporary permits for physicians.
Okay, so a physician, when they finish med school, when they finish their internships or whatever, if they cannot get a temporary permit to practice medicine until they have passed their relevant board exam.
Board exam or whatever I'm ignorant of all what the names of them are, but in order to be able to practice, you have to have passed the whatever it is, and you have to pass it within so many times, or you have to come to the board and request a waiver, and waivers are few and far between. So if you want to establish a practice whereby you give that extra grace as a matter of course without going to get a waiver, then yeah, you need to write it in.
Well, it's almost like two different things. Because the temp license piece is really designed for people who haven't taken the test yet. We already have it built in about the number of fails, and I think we're not changing that.
Okay.
But the temp thing, it does not sound like the physicians have an equivalent. It sounds as if
they don't. That's correct.
Okay. Oh, I don't know what to say. I can only tell you from the perspective of like the students and the debt and
yeah, it's like you want them to be able to work, but there has to be some sort of limit to like get them like time wise to motivate them to study for the exam. And like
I
you say,
wouldn't
like
have a problem with not giving it an extension to saying that a temporary permit will last 3 months. You do with it what you can. If you can't manage to take and pass the board exam in 3 months, then you're not going to be allowed to work.
Lose it. Yeah, I mean, I feel like that's fair. I mean,
no, we give them another 3 months.
Right, but I'm saying like we could limit it to the 3 months.
We could. That it's not renewable. It will.
Right, and then that way, like in Raylina's case, she would have 3 months to. I mean, because you think about it, 3 months, like that's not a whole. I mean, it is a lot of time, but it's not a whole lot of time if you're working full time to study. You know, and carry on with life. For 3 months, I feel like at least that's sufficient to study and retake it.
I would agree. And I have to keep in mind that back when I took the test, it wasn't offered on the timeline that we have now. It's much more, and we had to wait, I don't know how many weeks to get the actual, and you had to wait for them to come in the mail. So, I mean, there were so many different elements to that slowed the process, but now that it's so readily available, I think that sounds adequate.
So do y'all want to limit it to like 3 months? And then if they don't pass it, then
we go back
to the discretion of the board.
Yeah, I guess. Yeah,
but I mean, there is supervision thing. So, you know, Dr. Van comes back with like, it's protecting the consumer. mean, we do have supervision guidelines in place, but
And actually my question, the reason I have some stuff highlighted in blue, y'all, is it does feel like the supervision isn't that much. It feels very extremely minimal, considering you are talking about a practitioner who has not yet passed their boards.
Demonstrate, that's right, demonstrated the requisite competency via testing.
Right, and we've currently got it in my first blue highlight, it says close supervision of the temp holder is adequate to ensure the safety and welfare of patients. So that sounds good. It's like, okay, you have to do it however much is required for the safety of patients. But then in the next paragraph, it says, an OT with a temp license shall be deemed to be satisfied with this direction for not less than 2 hours each week, which of course means a lot of employers are going to take that to mean, well, all I got to do is give 2 hours per week of supervision.
You can be guaranteed that's what they'll say.
yeah, and that's not enough.
I don't
2
think it
hours.
is enough either.
I mean, we could do the supervision like that's similar to a tech or an aide,
We could.
because I mean, that's really what they would be. Honestly, a little bit better, you know, a little bit more knowledge, obviously, but
Yeah.
I mean, that really isn't enough.
And also if you can keep in mind when you're making your decision, if you write a rule that says a 3-month temporary permit and it can't be renewed, if that's the policy decision you make, and it's up to you what, you know, whatever you decide, you have to be willing to stick to that, in the sense that if you have come to that decision that that's the appropriate time frame, the board is going to defer to your decision regarding that and not want to have to come back frequently and have somebody who says, well, mine was 4 months because I had this personal situation, or mine was, this, that, or the other thing. So I'm not telling you which way to go, what to propose, but whatever you propose, that's what you should be prepared to live with, because that has to be the rule, and absent some really extraordinary circumstance, we can't come in and have waivers and for other circumstances.
Yeah. So going back to that Texas definition, I just went to look and see what they said. They're saying that the board only issues a temporary license to an applicant who's taken the MVCT certification exam for the first time. And it says it's not available to applicants who have received a license in any other state or territory as an OT practitioner, or to applicants applying military non-licensed.
So they only provide the temp license if they have taken the test?
It just says to an applicant who is taking it for the first time. So that would be like graduate and you're going to take it. And so then it says, they have to meet the provisions. They have to submit the confirmation of exam registration and eligibility, submit a copy of the receipt showing the score report, submit a signed verification of supervision, send the board non-refundable temp license fees. And then it said, if the applicant fails to take the exam during the eligibility window as stated in the confirmation of examination eligibility, or fails to have the score reported, the temporary license is void and must be returned to the board. An additional temporary license will not be issued, and a temporary license shall be valid no longer than 180 days.
Yeah, so that's obviously contemplating back when it was more difficult to take the test, less convenient, I should say.
Yeah, because that's 6 months.
Yeah, so yeah. But they only gave the license to people who were doing it for one time. And then if they didn't pass, they took it away.
But that's the same with ours. Ours is also that. Well, I mean, ours is also only for the first time people.
Is it first time people or you can fail once?
Well, the way our thing is currently written, the temp license is to an OT applicant who has completed the academic but has applied for and is waiting examination. So
Okay.
ours is for the same population as Texas is. It's
Gotcha.
for people who are taking the exam for the first time.
Okay.
Yeah, but they can still keep theirs if they fail for us.
Correct. That's a difference.
That's the difference. So they can fail it up to 4 times and still keep it.
Yes, I mean, if we tightened up our time frame to 3 months, that would reduce with no dual, that would seriously reduce
Yeah. So
the possibility that somebody fails it that many times on a temp license.
but yeah. I mean, I think we need to come up I guess allow them to have this temporary permit, allow it to be good for 3 months. If they fail it, then maybe they have to get special permission from the board. I mean, I don't know. And then we need to tighten up the supervision for sure. And maybe keep it as the assistant. They have to have on-premise direction and immediate supervision for not less than 50% of the assigned caseload.
I like that.
That's how we have it written if you kept going under the OT assistant.
Mm-hmm.
And so we just need to come to an agreement on a time frame. Do we feel like the 3 months is okay? And then if they fail it, then they have to get a request from the board to apply for another one. And that way it's not saying you definitely can't get it, but
Well, apply to the board for another temporary permit.
yeah.
Yeah, no.
Say if they have extenuating circumstances or.
I would think my concern is that if the circumstances are so terribly bad that they can't take and pass the test, should they be I mean.
Right. Ingrid, tell us what's the percentage rate of them passing the first time?
Out of the 35 who just graduated, I had 5 who had to take it more than once. So that's 80% pass on the first try.
In your mind, would you be comfortable with those 5 continuing to work? You know what I mean?
Yes, if they were closely supervised, if they were under direct supervision, I would, yeah.
And how many times did they have to take it before they passed?
4 of the 5 passed it on their second time. 1 took 3 or 4. Might have been 4. It was getting close to where I was like, oh my God, this person might not get licensed in Louisiana. I was getting really scared. So yeah, 4 of the 5 passed it on the second time. 1 took more.
All right, we need to come to a decision.
I know we have differing opinions on it. And if we, I guess, go with what Raylene and I are interested in of allowing a temp license, it's a possibility that the board
permit, please. Permit, please. Temp permit.
Permit.
I mean, it is a possibility that the board will reject it, but
Dr. Van, do any other professions allow for temporary permits in this situation?
There are people, some of them have temporary permit abilities, but they pretty much hold the line on 4. Okay.
The physician assistants, you get 1, and if you fail the exam, it's immediately terminated. So you can't get another one after that. There is no, but then their permits last a year and can be renewed for another year. But the moment you fail the exam, it's void and you can't get another.
wow, they're letting them go a long time without taking the exam at all. That's something.
All of that's in process, all I can say.
Okay, so I think Dr. Van, we're saying, I think generally, obviously we don't have a motion yet, that we're wanting to allow temporary permits. And our decision now is to how many times they can fail, because we feel like we need to tighten up the supervision.
Well, let me make an observation. If you talk to psychometricians, they will tell you the more they take the test in close intervals, the more likely they are to pass. So, for example, if they took it today and again in 3 weeks and again in 3 weeks and again in 3 weeks, they're more likely to pass before 4 times, simply because they are being taught by the test itself. So the thing you want to do is, if you want to make this happen to them,
For them.
I think for them, thank you very much for that. I appreciate that. The key is make them take the test quickly, not go back to work a lot, because they really need to be studying so that they can pass the test. And again, I think you owe it to the public to say these people are going to be tested and granted a license like everybody else, that they have to have some minimal standards.
We were talking about having the temporary permit last for 3 months with no possibility of renewal. And that the supervision of a person operating under a temporary permit would have to be direct supervision, at least 50% of their caseload. Direct would mean on premises, readily available within the same treatment area.
Why would it only be 50%? Why not 100%?
And we could make, we had that conversation just now back and forth. We first were talking about 100%, then we talked about 50. 50% is what we currently use with
the assistants.
The assistants for what? The assistants who are
holding
what?
a temporary license.
Oh, that's the assistants who have a temporary license. Okay.
It says that an OT assistant holding a temporary license shall be deemed to be satisfied on-premise direction and immediate supervision by a licensed OT for not less than 50% of the OTA's assigned caseload, which is seen in conjunction with each supervising OT on a weekly basis. This applies to each OT who is supervising the OTA.
Well,
I mean, I feel like while they're on a temporary license, they need to be treated like a tech or an aide.
Well, yes and no, because a tech and an aide can't do what an OT can do. I don't know. That's a hard call.
Yeah, I mean, that's probably too strict, but I just, yeah, I mean, it's just so
But the
hard.
supervision can actually be, and we hope it would be, educational.
Correct.
So the more they are supervised, the more they will learn.
Kind of, it depends, because it depends, like, say you're in a pediatric environment, you're not really, and maybe the parts that you're failing are more related to like spinal cord injuries or things that you're not really doing, or inpatient. I mean, it's possible. Like, Ingrid, you can probably speak to that better than I can, but I know a lot of the stuff that was on the boards was not what I was doing.
Well, and the other thing is, if you make it too onerous, then the employer's not going to want to do it. The employer's going to say, just come back when you pass the test.
I would agree with that 100%.
Well, is this, so then we're going to make a rule that satisfies employers, and we still have to figure out how to protect the public in that regard, though.
Right.
No, that's absolutely true. It's the balance, whatever it ends up being.
I mean, look, I understand. Look, I had a son that could not take a test, okay? Had to have extra time and all those kind of things. We have people with learning disabilities. I understand that. But we're not, how do I want to say this? It is a privilege to get this license. It exists because it protects the public. Okay. And if we say to people, don't worry about taking that, you fail it, you can take it 2 or 3 times, who cares? Okay, fine. But now, again, the more they take it, the better their chance of passing it. And if they don't, the psychometricians would say more than 4 times, they just shouldn't be taking it at all. But there's a learning from taking the test. There's a learning from the supervision. And again, I think that the key here is that we have to say what's best for the public. We really aren't, we're concerned about the employment status. We're concerned about the fact that they have debt. But then again, too, that process should have been addressed in admissions. If this was such a bad test taker, they should have known about that when they admitted these people to these programs that caused them to be indebted.
Well, I don't know if I agree with that piece, but I hear what you're saying overall. And that, obviously if we don't grant temporary permits, people will know that ahead of time. They will realize that when they graduate, they just have to start studying. I mean, all of that is true. I just do feel that the anxiety about the debt is real, and that if somebody is directly supervised for at least half of their day while awaiting or the exam, or if they have failed it once but are still within the 3 months, that they would still be safe to practice occupational therapy. That's how I feel. And that if we tighten it to 3 months non-renewable, that would facilitate rapid re-examination by the applicant, and would protect the public from somebody who becomes a chronic failure of the exam. And if we tighten up the supervision, it would ensure their safety.
That would be my next question, would be the supervision. Go ahead, Dr. Van, I'm sorry.
I think that's wonderful. I think you're on the right track. I think we're doing what we can do to recognize sometimes people who have anxiety. We recognize that they have to work. We recognize that they have to pass the test. And we recognize we got to make sure the public is protected. And if y'all are comfortable with 3 months, all we're going to do is present it to the board, and the board's going to say yes, no, or change it to 2 months, or change it to 1 month, or modify it the way they want it. Again, I can tell you that I never know who reads everything and who doesn't read everything. So the good news is maybe they won't read that and won't get upset about it.
So I guess the next question would be, if we do the 3 months, what would you propose for supervision? Like looking at the document, how it's written.
Well, Pat's got a point. They may the employers may say, well, we're not going to do that. Go pass the test first. But I think you all have to think about what you would want to, how would you want to be treated if you were the client, by this person or somebody who was fully licensed? I mean, I know people who walk into the doctor's office and say, I don't want to see the nurse practitioner. I want to see the doctor. Okay. Are there situations where people would walk in and say, I don't want to see somebody who's not licensed? I don't know.
Yeah, I mean, we get that with assistants. Parents, they don't want OT assistants. They don't really understand that their competency level. I mean, but I just feel like we need to tighten up the supervision, because it was a little bit lax under a temporary,
Yeah.
now it'll be temporary permit, but under our previous temporary license section, it was not enough supervision.
I mean, I guess we have to, and Dr. Van is fond of saying this, and it might apply in this situation. I guess we also have to give some credit or deference or a presumption that the employers are going to do the right thing too, and that if you gave them no less than 50% of the time directly supervised, that other 50%, that supervisor or that employer would have ensured that the only things that would be provided during those periods of non-direct supervision were unquestionably within the practitioner's competence and so forth and so on.
Right, because ultimately the OT would still be responsible for them. So
Right.
they shouldn't allow them to do something regardless of a temporary permit or not. But we set that minimum.
Right.
It could be more,
It
like
could.
if they really feel like they're not competent, then it would maybe 100%.
Yeah, if they're just trying to help them out for some special reason or whatever, we could, I think, leaving it to the discretion of the supervising practitioner. At some point, we can have some reasonable level of trust and faith that they're going to do the right thing too. And 3 months is it's a long enough period of time to get it done under the current ability to take the test and prepare for the test. But it's a short enough period that if that person simply isn't actually capable of practicing without, further competence or whatever, that will be figured out before it goes on too long.
Darby, can you just read out the OTA thing right now? I'm just going to type it like that, and then everyone can see what I typed and discussed.
Okay. It says an occupational therapy assistant holding a temporary license under this section shall be deemed to be satisfied by on-premises direction and immediate supervision by a licensed occupational therapist for not less than 50% of the OTAs. You can just slow down.
Because we're really
If you cut and paste, it's right there in the green. It's only 2 paragraphs down if you want to cut and paste.
Oh.
It's on number 3. Not less than 50% of the OTA's assigned caseload, which is seen in conjunction with each supervising OT on a weekly basis.
It's really the same thing for whether you're talking about OT or OTA.
Yeah.
Yeah, that's what I'm saying.
That's what she's proposing.
Yeah. I forgot what you said. Supervising. Oh, I see it.
It's right there. Yeah.
Who is supervising?
This applies to each OT who is supervising the OTA.
Each.
Because that's the minimum. 50 would be the minimum. I mean, there may be some that would be more. And again, it's going to fall back on the OT and the employer.
Right. And the nature and reason why the person needs to have this permit for this very short period of time, relatively short period of time. It may be due to personal circumstances that don't relate to competence, but relate to some other life things. And it's just a question of being in a position to go take the test.
I'm just going to go back and look at what we just defined direct supervision. Supervision in which the supervisor is personally present and immediately available within the treatment area to give aid, direction, and instruction. So I actually would rather remove on premises because that's actually a looser term than direct supervision.
Yeah. So I think you just referenced that.
Yeah. So let's just take a look at this, what I wrote here. At paragraph A, the board shall issue a temp permit to practice OT to an applicant who's completed the academic and supervised fieldwork requirements. The temp license permit shall be valid for 3 months and will be non-renewable and is non-renewable. An occupational therapy practitioner holding a temp permit may practice OT only under the direct supervision of an OT licensed by the board, who shall provide such supervision for not less than 50% of the OT practitioner's assigned caseload, which is seen in conjunction with the supervising OT on a weekly basis.
Okay. So then we don't really need 1. And we probably don't need 3 because they say the same thing, right? So you could 3 is the assistant and we're doing the same thing. 1's just going back to on-premise direction and immediate thing. So I think you can take out 1. We need 2 because that talks about you can't be supervised with more than 2 therapists. And then 3 says the same exact thing with about assistant. Look, we just made it more concise.
Let's just make sure B makes sense. I think A makes sense. It's very clear who we're talking about for a temp permit and the fact that it's valid for 3 months and is non-renewable. But let's just make sure B makes sense.
Board needs to be capitalized. I know that. Yeah, I think it does.
I'm wondering if this should be clarified to the temporarily licensed OTPs to differentiate it from the licensed OTPs.
Well, it's going to be a temporary permit. It's not going to be a license.
Yeah, it's temporarily permitted.
They're not going to get a license, even a temporary one.
We got to change a lot of wording in here for that. Yeah, that makes it more clear.
And I feel like, Ingrid, too, if we throw in the word direct again, like, so it says under the direct supervision,
okay,
who shall provide such direct supervision.
Such direct supervision,
Yeah.
okay.
So I don't just like glance at it, read half the sentence and be like, I'm good. It doesn't have to be direct, just has to be supervision. I think that helps clear it up.
What is on a weekly basis mean? It's 50% on a weekly basis? Like, isn't it just 50%? I don't understand why we need on a weekly basis.
Yeah, we're going back a year.
Well,
we talked about this.
Okay, what you could do is see no supervision this week and all supervision the second week.
Right.
And that would be 50%. But
That's
you really want
right.
to.
Yeah, we're right. Thank you. And now I remember that whole conversation.
No problem.
It all just came flying back to me. Oh yeah. People try to cheat the system. I forget.
And look, it happens everywhere, believe me.
Oh, I know, unfortunately.
That's the old adage. Locks keep honest people honest. That's about what it's about.
Yeah. Everybody happy with that? These changes? Brenda, you read through B? Your last chance to make your mark.
It looks good.
Okay.
And then we'll also
look at
need
C.
to
Let's just look at C. We've got some stuff in black here that is changing now. Letter C up here.
So it should say a temporary permit.
Yeah, but I think we're getting rid of it. We're not going to renew it.
Oh, shall be renewable. Yeah.
So you can drop C.
Yeah, you can get rid of that completely. And so, Dr. Van, this section should be called temporary permit, not temporary license, correct?
Right.
Okay. So it's in the title, and then it's also in paragraph A two at the last sentence. So it's
Well, like you're gonna, for example, in section 1939, you're going to change that to the permit and all that kind of stuff. But again, that's Pat will do that. You know, we'll get Pat will make sure those kind of edits are done.
Right, I'll go through and make everything consistent.
Yeah. And so before I forget, Pat and Ingrid, can y'all stay on for a few minutes after the meeting ends? Because I have some questions.
Sure.
That relate to some of these. Yeah.
Okay. May I never say the word temporary license again.
I know, right? Dr. Van was on you. He was like,
well, listen, I have to learn how to say things differently too, so don't be afraid. We all make those
Ingrid,
mistakes.
There's more, Ingrid. You just finished that last one, but the sentence goes on, I think.
Well, again, Patricia will handle all of that.
She'll get it. Yeah. All right.
Yeah. Okay. So make it green, and maybe we can get a motion to accept.
I move to accept the changes as written.
This is
second
Amy. I'll accept it.
Okay, I'm sorry, who seconded it?
I said it and Amy said it, so whoever you want to pick.
Wait, Brenda motioned, right?
Brenda motioned, yep.
Brenda motioned, and then who seconded?
Darby.
Darby seconded, okay. All right, I'm ready.
Sorry, Amy. All in favor, please say aye.
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 Anyone oppose or abstain? Dr. Van, can you please check to see if there's any public comment?
There are no public comments, ma'am.
All right, so all good. Ingrid, anything else? You got it all?
Yeah, it's all green.
So there's no other business, but I just wanted to let everyone know that this has been a complete honor. Although a lot of work, it's still an honor. And thanks to everyone to everything and anything that they've done, answering emails and phone calls, and most importantly, your support, expertise, and knowledge. I really learned a lot over the past 6 years and will continue. And I really want to thank Dr. Van, who has been attending and guiding us and been such a good advocate for our profession. We're really lucky in Louisiana to have you.
Well, thank you very much. And I really owe you all the same. You all have done a yeoman's job. Y'all have worked very hard. I brag on you all the time. And I'm only hoping Pat and I can get the work done so they could see this in February.
Oh, they will.
And Brenda, I'm sure you may want to have a few words to say. You've been with me the whole 6 years.
Yeah, I second that sentiment, Darby. It truly has been an honor to be part of this group and part of advocating for our profession and making sure that our profession is practiced in a manner that is safe for the public. And it's been an honor to be part of a group of. It's just been an honor.
We're gonna miss y'all. Oh my God.
Absolutely.
But we're still here.
I might sneak in invite Darby once or twice.
I mean, Brenda and I are still here, and I'll speak for Brenda because I know we've talked about this. It's kind of hard to let go. Everybody's like, "Oh my gosh!" Like Amy even said, she's like, "Aren't you going to be so relieved?" And I'm like, "No, I'm going to miss it, and I want to see it to the end, and I want to support them and be here." And so just know that we're both around, and whatever roles we can play that'll support you. For all of y'all. And Ingrid, I have no doubt you'll find a great co-chair and we'll continue the path that we've been led on.
Thank you. Thank y'all. Thank y'all for everything you've done. Seriously.
We have an amazing committee. So I feel like the two of us, are the two new people coming in and the people that have been on here I have so much confidence in. So that makes it so much easier for Brenda and I to leave for sure.
Well, you know where we are about this time every month, so don't hesitate to ask for that Zoom invite if you just want to come listen in.
I hope I get the invite. Ingrid, do you need to talk about the next meeting, or are y'all going to do that separately?
Yeah, we have not, I have not reached out to Dr. Van to get the best dates for 2024. So that's on the to-do list. Dr. Van, expect to hear from me soon.
All right, Olivia and I'll be waiting to hear from you.
All right.
Thank you all
Everyone
again.
have-
Really and truly, I deeply appreciate all the hard work you've done. I wish all of my committees could understand how hard this is and do the work you do. And I am very gratified and very thankful for all you've done. So I can't tell you how much I appreciate it. And I know it's been tedious at times, but you all have, and I have been advertising it as a complete overhaul of the rules. So I know what you've done, and I recognize it, and I thank you for it, and I'll do my best to get it passed at the February meeting.
Fantastic.
Sure.
Great goal.
Well, everyone have a great holiday, and I'm going to stay on and talk to Ingrid and Patricia about just like what has to be done with this so that it's in the right condition for y'all for January and February, because I feel like there still needs a lot of work, to get it ready for you.
Well, Merry Christmas to everybody and Happy New Year.
Merry Christmas. Bye.
Thank
Christmas,
you.
and thank y'all
Wishing
again.
you the same.
Brenda.